Hi, I'm going to be presenting about Chagas disease, also known as the American trypanosomiasis. Introduction. Chagas disease is a parasitic disease affecting humans and animals. It's an endemic mainly in Latin America, which can cause severe cardiac and gastrointestinal complications. It often remains asymptomatic for years before symptoms appear, and it is caused by a Trypanosoma cruzi and was described by Carlos Chagas in 1909. Moving on to the causative agent. The organism responsible is the Trypanosoma cruzi, which is a protozoan parasite, and it also belongs to the phylum Aglenozoa, which is an intracellular parasite that invades body tissue. It survives and multiplies within human cells. How it is transmitted. It is transmitted through a tritomine bug, also known as the kissing bug. It gets this name because it frequently bites near the eyes and the mouth during sleep. Other transmission routes, we have blood transfusion, organ transplantation, congenital transmission, that is from mother to fetus, contaminated food and drinks, and also laboratory accidents. The pathogenesis, the mechanism of the disease. 1. The bug bites human skin. After that, the parasite enters through wounds or the mucous membrane. Then the parasite enters into the bloodstream and invades the muscle and nerve cells, hence leading to multiplication inside the tissues, which may cause inflammation and cellular destruction. It mainly affects the heart, the esophagus, the colon, and the nervous tissue. Moving to the effects of Chagas disease on the body. During the acute stage, there is fever, fatigue, headache, swollen lymph nodes, and enlarged liver and spleen, also swelling around one eye. For the chronic stage, there is heart enlargement, cardiac arrhythmias, heart failure, and sudden cardiac death or megaesophagus. The mortality rate of Chagas is low in acute phase, which is around 1 to 5%, and in chronic phase is around 20 to 30%. And patients who develop Chagas cardiomyopathy, the risk of death increases significantly because of heart failure, irregular heart rhythms, sudden cardiac death, and thromboembolic events such as stroke. Going to the diagnosis and the treatment. Diagnosis can be done through the laboratory diagnosis methods like blood smear, microscopy, PCR testing, indirect method, the ELISA, immunofluorescence assays. And going to the treatment and management, we can use drug therapy like benzodiazepine, which is the first line treatment and it's mostly effective in acute infection. Then we have the nifurtimox, which is an alternative treatment. Also go for cardiac medication, pacemakers for arrhythmias, and surgical management of digestive complication. And we are going to look at the role of a physiotherapist when treating Chagas disease. 1, they go for assessment like evaluation of muscle strength, endurance, and functional mobility. 2, exercise therapy like prescription of low to moderate intensity exercise to improve cardiovascular fitness, and respiratory physiotherapy like teaching breathing exercise and management of cardiac complications. And lastly, we are going to look at the prevention and the control. 1, we can go for public health measures like blood donor screening, organ donor screening, prenatal testing, food hygiene and sanitation, health education, also community awareness programs, and early diagnosis campaign. For the prevention is vector control, insecticide spraying, improved housing construction, bed nets, and window screens. Thank you.